This video has been brought to you by GoFiber. Enter your pictures and win a 1-year supply of GoFiber. It's easy to enter. Order a free sample, take a clear before and after pictures, and send them to selfie@gofiber.com. Hey, welcome back guys, Matt here, and in this video I'm going to be interviewing David DiMuzio from the channel Hair Loss Hope. We have been chatting with David, I think it was like 2 years ago, when I brought him on my channel to talk about his 3 FUT experiences, but in this video it's going to be different. We're going to be talking about his oral minoxidil experience, and I didn't know he's been on oral minoxidil until like 2-3 weeks ago when we were chatting again. How long have you been taking oral minoxidil? How many times per day? What was your dose? And have you experienced any side effects so far?
So I've been taking oral minoxidil as part of a compounded pill. So the pill that I take is actually, I think it's 1.1 milligrams of finasteride, 5, it just says 5 on the actual bottle. So I don't know if that's 5% or 5 milligrams, to be honest, of the oral minoxidil. But I get this compounded by Stonegate Pharmacy. So it's the finasteride, that 5 something of oral minoxidil, and I think it's 1 milligram of biotin. So it's all just one pill, super easy. I take that once a day. Dr. Daniel McGrath, who is my surgeon who did my 3rd surgery, FUT surgery, he prescribed this to me, and he's been prescribing it for his patients, I think now close to 2 years. So I think I started taking it after he'd been doing it for about a year or a little bit more than a year. And he called me and was like, hey, this pill that I've started prescribing, people are having incredible results with this. I'd suggest that you get on it because, you should give it a shot.
Okay, cool.
So I've been taking it for a little less than a year, I think.
Of course, you stopped with finasteride, right? Because finasteride is contained in this pill, so you must have stopped.
2 or 3 years that I didn't take finasteride. Then I got on topical finasteride, which also had the minoxidil as part of it. It was also compounded by a compounding pharmacy, topical finasteride minoxidil compound. And I used that for about probably 8 months or so, something like that. Yeah. And so then that's when Dr. McGrath called me and said, hey, you should try this pill. And there were a few things that got me interested in it. So 2 of my brothers are also on this pill as well. And they both had incredible results from it. I mean, one of them, like he was just at the beginning of his hair loss, and all his hair is like now come back. Like he looks like he's never lost any hair. But that said, he just was like starting to get the temples receding, a little bit of thinning in his crown. So he hadn't lost that much hair. He was just like starting to have a little bit of miniaturization, but enough that it was noticeable. And it's basically brought all of that miniaturization back. So it's now all thick, strong hair. And then the other brother, he'd already lost quite a bit of hair. Like his whole top of his head was pretty thin, but it's brought it back to the point that his hair actually looks good now. Like it's still thin, but it's not like obvious that he's balding anymore. So it was after they got on it, I think, as well, and had those results. And then I was like, okay, I'm going to give that a shot also. And that's what I've been using.
Yeah, it's cool. Always, I also noticed that sometimes doctors, like hair transplant surgeons, they have like contracts with different pharmacies, and they only that's like one-of-a-kind medication that they just have compounded by one pharmacy that nobody knows about. Only if you are a patient of this doctor, you will be like, wow, you do that. You prescribe that type of like hybrid medication, and it sounds good what you're saying. My question is, since you said you've been on topical minoxidil and topical finasteride combination prior to that, I think it was also this latanoprost, I guess, right? That was also inside.
That was in the topical.
Exactly,
yes,
exactly.
And I also had retinol or retin-A or something as well. I think was part of that. Yes. So I obviously stopped taking that because I'm doing the oral. I think that that's a good option for people that are experiencing side effects from finasteride. Is the topical. I have talked to a few people that have said that they had finasteride side effects, but then they've gotten on the topical and did not have any. I have no scientific proof of why that is or anything, but I have talked to a couple of guys who have told me that. And mean, that was my main reason for getting on the topical, was just still a fear of potential side effects from finasteride. I've since kind of changed my mind about that and just gone, you know what? I've been on and off finasteride now like 3 or 4 times. I've never had any negative side effects. My brothers have been on it. They were, especially one of them, the one that was the most bald, he'd been pretty terrified of finasteride from the things that he'd heard. And it was only after the other younger brother got on it and got all his hair back that he was like, okay, maybe I should give that a shot. He didn't listen to me, but he listened to my other brother who knows nothing about hair. But yeah, it was only after that we all just were like, you know what, like, we're not having side effects from this. Let's just get back on this. So.
As far as the efficacy, when you switched from topical minoxidil, topical finasteride, and latanoprost topical, you switched onto oral minoxidil and oral finasteride. Did you notice any difference?
Absolutely. I have definitely gotten stronger hair since getting on this oral pill. So yeah, between the topical and the oral, just in how strong it is and how well it works, definitely the oral is better. The topical also worked. I definitely saw improvement in my hair from being off the finasteride for around the 2 to 3 years. When getting on the topical, I definitely saw improvement, but I saw even more improvement when I got on the oral.
Can you maybe even kind of say in particular what was like responding better? Was it the front? Was it the crown area? Or was it like you didn't really notice?
It was actually just the strength of my hair in general. It's like how strong and thick the individual follicles of hair are is actually what I really noticed. So I don't think I really lost a lot of hair when I was on, like lost as in completely disappeared, kind of when I was on when I was off of finasteride. It was just that my hair felt a little thinner, right? Had a little bit of miniaturization. So it just like each follicle wasn't quite as strong. And then when I got on those individually, it just sort of like ramped it up to where like every single follicle of mine now is very strong. Even though my hair itself like isn't that thick, it looks quite thick because of how strong the hair that is there is,
Mm-hmm. Interesting. Did you notice that also on the transplanted hair or only on your native hair?
Oh, definitely the transplanted hair as well. I would say that the biggest myth that exists within the hair transplant field or community, and unfortunately it's very much like expounded upon by many surgeons, especially many surgeons that don't do hair and hair loss full time. They continue saying that, oh, the transplanted hair like is DHT proof. Like once you transplant it, you're good. Like that hair will never fall out. And that hair is still attacked by DHT. I always use the example that the transplanted hair is DHT resistant. It's not DHT proof. And the same way that a watch is water resistant. It'll say water resistant. That doesn't mean that you can go diving with that watch. It just means that if you get a little water, like as you're washing your hand on the top of it, it's probably not going to stop working. But it's not, you shouldn't submerge that in water. And at the same time, once that hair is on the top of your head, it's DHT resistant, but it can still miniaturize. It still even can fall out, just like, as the hair on the side of your head can get thinner and fall out.
It's the last question on topic of oral minoxidil. The side effects, since you didn't tell anything, I assume you didn't have any side effects, because I don't know if I don't know if Dr. McGrath kind of told you about that, because if you get an oral minoxidil, since it's like anti-hypertensive vasodilator, it's meant to lower your blood pressure, and it's being used for this purpose, not for treating hair loss. It can come with some side effects, as many guys watching my channel know, like swelling on hands, legs, and these are not so bad side effects like the cardiovascular side effects like heart pumps, palpitations, and all these things, of course, increased body hair as well. So did you experience any of these or none?
I've had no side effects from it, no noticeable side effects. Neither of my brothers have had any noticeable side effects. The people that I know that are on it, the only one is my friend Jay International, who's a viewer on my channel, he's had like 9 or so hair transplants and a lot of experience. He's currently on oral minoxidil, and he said that he's a very hairy guy, and he said that he's seen even more hair, body hair, since he got on oral minoxidil. But funny enough, he's actually very happy about that because he has very little hair on the sides of his head to transplant because he's had so many surgeries that have been botched and all these things. So he's been doing a bunch of body hair transplants. And so he's actually happy that he's getting more body hair because he's been transplanting that body hair to the top of his head. Pretty crazy. Guys that I talked to down at Dr. McGrath's office when I've been there visiting, and I've met a bunch of different patients, and all the ones that were on this pill, none of them mentioned any kind of side effects to me. So I think overall, and I mean, I think that Dr. McGrath would be quite weary of that if he was noticing side effects with all of them, which I think is why he waited to call me and kind of wanted some other people to try it and stuff. So I know he's on that as well. Dr. McGrath is on that, and I'm pretty sure that Steve Cook, my friend who does consultations for Dr. McGrath, is on it also.
I hope you enjoyed this video. I hope you learned something new from it. And if you want to research on or read more on topics of oral minoxidil, I highly suggest you checking out my oral minoxidil video series I created this year. It has only 3 very short episodes, but they're very on point. They're talking about the potential benefits, side effects, the science behind oral minoxidil, studies, and also things like before and after photos, which I'm showing in the videos, as well as doctors who've been prescribing oral minoxidil for many years, sharing their view on this. Okay, so check out the series, and I'm going to see you in another video.